Right now, in medicine cabinets across America, sits a seemingly innocent medication that's silently destroying the kidneys of millions of people over 60. This kidney damage medication seniors take daily is so common, so trusted, that doctors hand it out like candy. Yet recent studies reveal it's responsible for sending over 100,000 Americans to emergency rooms every single year with kidney failure. Here's the shocking truth nobody wants you to know. The very medication you reach for when your back aches, when your knees hurt, when you have a headache, could be the reason your kidneys are slowly shutting down. And the scariest part? Most people have no idea it's happening until it's too late. If you're over 60 and you've taken pain medication in the last month, you need to hear what I'm about to reveal, because what I'm going to show you in the next few minutes could literally save your life. The dangerous drugs over 60 that I'm talking about are probably sitting in your kitchen right now, and the kidney damage they're causing is happening faster than you think. Stay with me, because by the end of this video, you'll know exactly which medications to avoid, how to protect your kidneys starting today, and the warning signs that could mean you're already in danger. Every day, thousands of seniors across the United States wake up, take their morning medications, and unknowingly take another step toward kidney failure. The medication I'm talking about isn't some experimental drug or rare prescription. It's something so ordinary, so widely accepted, that it's become invisible in our daily routines. But here's what the pharmaceutical companies don't want you to know. NSAIDs kidney failure elderly cases have skyrocketed by 300% in the last decade. That's not a typo. 300%. And yet, these medications are still being recommended by doctors, sold over the counter, and trusted by millions of people who have no idea they're playing Russian roulette with their kidneys. My name doesn't matter, but what I'm about to share with you does. I've spent years researching the connection between common medications and kidney damage in seniors, and what I've discovered will change how you think about pain relief forever. Here's exactly what you're going to learn in this video. First, I'll reveal the specific class of medications that's causing this epidemic of kidney damage. Then, I'll show you the 5 warning signs that your kidneys are already being damaged. Next, I'll explain why people over 60 are especially vulnerable to this silent killer. And finally, I'll give you the exact alternatives that can provide pain relief without destroying your kidneys. But before we dive deep into this life-saving information, let me ask you something that might shock you. When was the last time your doctor warned you about the kidney risks of over-the-counter pain medications? If you're like most people, the answer is never. And that's exactly the problem we're going to solve today. The medications to avoid after 60 that I'm about to reveal are so commonly used that mentioning their names might surprise you. But the science is clear, the evidence is overwhelming, and the time for ignorance is over. Let me start with a story that will make your blood run cold. Margaret Thompson, a healthy 67-year-old grandmother from Ohio, took the same pain medication every morning for her arthritis. Her doctor said it was safe. The pharmacy sold it without questions. For 3 years, she followed the exact dosage on the bottle. Then one morning, she couldn't wake up. Her daughter found her unconscious in bed, her skin yellow, her breathing shallow. At the hospital, doctors delivered devastating news. Margaret's kidneys were functioning at only 15% capacity. She needed immediate dialysis, and without it, she had weeks to live. What caused this catastrophic kidney failure? The same medication millions of seniors take every single day. NSAIDs, non-steroidal anti-inflammatory drugs. You know them by names like ibuprofen, naproxen, aspirin, and dozens of others. These health-warning seniors' kidneys medications are literally everywhere. Here's the terrifying reality. Every single day in America, 15 people over the age of 60 are hospitalized with kidney failure directly caused by NSAIDs. That's over 5,000 people every year. And these aren't people who abuse these medications. These are people who followed the directions exactly as written. The problem isn't that these medications don't work for pain. They do. The problem is that after age 60, your body processes these drugs completely differently. Your kidneys, which have been filtering toxins for 6 decades, start to slow down. When you add NSAIDs to kidneys that are already working harder than they should, you create a perfect storm for organ failure. But here's what makes this even more insidious. The damage happens slowly, invisibly, without symptoms. Your kidneys can lose up to 90% of their function before you feel anything different. By the time you notice swelling in your legs, fatigue that won't go away, or changes in your urination, the damage is often irreversible. Dr. Sarah Chen, a nephrologist at Johns Hopkins, calls NSAIDs the silent kidney killers of the elderly. In a recent study she published, she found that seniors who take NSAIDs regularly for more than 2 weeks have a 50% higher risk of chronic kidney disease. 50%. That's like flipping a coin with your kidney health. The pharmaceutical industry knows this. They've known it for years. But because these medications are so profitable, and because the kidney damage takes time to develop, the connection often goes unnoticed. Your doctor prescribes them because they provide immediate pain relief. You take them because they work, and your kidneys slowly, silently begin to fail. Now, I need you to think about this. How many times in the last month have you taken ibuprofen, Advil, Aleve, Motrin? If you're over 60 and the answer is more than once, you need to pay very close attention to what I'm about to tell you next. To understand why these common drugs, kidney risk medications, are so dangerous for people over 60, you need to understand exactly what happens inside your body when you take them. When you swallow an NSAID, it doesn't just target the pain in your knee or back. It travels through your entire bloodstream, affecting every organ in your body, including your kidneys. And here's the crucial part that most people don't understand. Your kidneys rely on the same inflammatory pathways that NSAIDs block to maintain proper blood flow. Think of your kidneys like a complex filtration system with millions of tiny filters called nephrons. Each nephron needs adequate blood pressure and blood flow to function properly. NSAIDs work by blocking an enzyme called cyclooxygenase, which produces prostaglandins. These prostaglandins normally help keep the blood vessels in your kidneys open and functioning. When you block these prostaglandins with NSAIDs, the blood vessels in your kidneys begin to constrict. Less blood flows through your kidneys. The filtration rate drops. Waste products that should be filtered out start building up in your blood. This is the beginning of kidney damage, and it happens every single time you take these medications. But here's where age makes everything worse. After 60, your kidneys naturally lose about 1% of their function every year. This is normal aging. Your blood vessels become less flexible. Your kidney tissues become less resilient. You have less reserve capacity to handle stress. When you add NSAIDs to kidneys that are already operating with reduced capacity, you're asking them to work harder while simultaneously cutting off their blood supply. It's like asking someone to run a marathon while you slowly tighten a tourniquet around their leg. Dr. Michael Rodriguez, a geriatric medicine specialist at the Mayo Clinic, explains it this way. In younger people, the kidneys can compensate for the temporary reduction in blood flow caused by NSAIDs. But in people over 60, especially those with high blood pressure, diabetes, or heart disease, the kidneys often can't recover. Each dose causes a little more permanent damage. The over-the-counter medicine dangers extend beyond just kidney damage. When your kidneys can't filter properly, your blood pressure rises. This puts stress on your heart, increasing your risk of heart attack and stroke. The medications that were supposed to help you feel better end up threatening your life in multiple ways. Recent research from the American Journal of Nephrology found that seniors who take NSAIDs for more than 30 days have a 40% increased risk of developing chronic kidney disease, a 25% increased risk of heart failure, and a 35% increased risk of stroke. These aren't small numbers. These are life-changing statistics. But the most shocking discovery came from a 2023 study published in the New England Journal of Medicine. Researchers followed 15,000 seniors for 5 years. Half took NSAIDs regularly, half didn't. The results were staggering. Those who took NSAIDs had twice the rate of kidney failure, 3 times the rate of dialysis, and were 60% more likely to die from kidney-related complications. And here's the part that should make you angry. None of these people were warned about these risks. Their doctors prescribed these medications. Pharmacists filled the prescriptions. The FDA approved them for over-the-counter sale. Everyone in the system failed to protect the people who trusted them most. If you're feeling overwhelmed by this information, I understand. But knowledge is power, and the power to protect your kidneys is in your hands. The question isn't whether NSAIDs cause kidney damage in seniors. The science is clear. They do. The question is what you're going to do about it. Before I show you the warning signs that your kidneys might already be damaged, I want you to do something important. If this information is opening your eyes to risks you didn't know existed, hit that subscribe button right now. Because the kidney health tips for elderly that I share on this channel could be the difference between healthy aging and spending your golden years on dialysis. Now I'm going to share something that could save your life. The 5 warning signs that NSAIDs are already damaging your kidneys. Most doctors won't tell you about these because they're subtle, easy to dismiss, and often attributed to normal aging. But they're actually your kidneys crying out for help. Warning sign number 1. Changes in urination. This doesn't mean you're urinating more or less. It means the color, smell, or foaming has changed. If your urine is consistently darker than light yellow, if it has a strong odor even when you're well hydrated, or if it foams up in the toilet bowl, your kidneys are struggling to filter properly. Sarah Martinez, a 65-year-old teacher from Texas, ignored this warning sign for months. She'd been taking ibuprofen daily for her back pain and noticed her urine had become darker and foamy. Her doctor said it was probably dehydration. 3 months later, she was in kidney failure. Don't make Sarah's mistake. Warning sign number 2. Unexplained fatigue that doesn't improve with rest. When your kidneys can't filter waste properly, toxins build up in your blood. These toxins make you feel tired, weak, and mentally foggy. If you're sleeping well but still feel exhausted, if simple tasks feel overwhelming, if your energy levels have dropped significantly, your kidneys might be failing. Warning sign number 3. Swelling that starts gradually and gets worse. This usually begins in your ankles and feet, then moves up to your legs and eventually your hands and face. The swelling is caused by your kidney's inability to remove excess fluid from your body. Many people dismiss this as normal aging or blame it on standing too long. But persistent swelling is often the first visible sign of kidney damage. Warning sign number 4. Shortness of breath that seems unrelated to physical exertion. When your kidneys fail, fluid builds up in your lungs. You might find yourself getting winded climbing stairs that never bothered you before. You might wake up feeling like you can't catch your breath. This isn't your heart or your lungs, it's your kidneys failing to do their job. Warning sign number 5. Changes in appetite accompanied by nausea. Kidney failure causes a buildup of waste products in your blood that can make you feel nauseous, especially in the morning. Food might start tasting metallic or unappetizing. You might find yourself eating less without trying to diet. This combination of symptoms often signals advanced kidney damage. Here's the crucial point. If you have any 2 of these warning signs and you've been taking NSAIDs regularly, you need to see a doctor immediately, not next week, not when you feel worse, today. But here's what most doctors won't tell you. Standard blood tests can miss early kidney damage. The test doctors usually run, called serum creatinine, doesn't show problems until your kidneys have lost more than half their function. By then, the damage is often irreversible. There's a better test called cystatin C that can detect kidney damage much earlier. If you're over 60 and you've been taking NSAIDs, ask your doctor specifically for a cystatin C test. Don't let them brush you off with a standard blood panel. Dr. Jennifer Walsh, a nephrology specialist at Cleveland Clinic, says, "I see patients every week who've been taking NSAIDs for years with normal creatinine levels. Then they get a cystatin C test, and we discover they've already lost 40% of their kidney function. Early detection is everything with kidney disease. The silent kidney killers at home are only silent if you don't know what to look for. Now you know." The question is, are you going to act on this knowledge? I want you to take a moment right now to think about your body. Have you noticed any of these warning signs? Have you been dismissing symptoms as normal aging when they might actually be your kidneys asking for help? If you recognize yourself in any of these warning signs, please don't wait. See a doctor. Get tested. And whatever you do, stop taking NSAIDs until you know your kidney function is normal. But what if you're already experiencing kidney damage? What if it's too late to prevent it? That's exactly what I'm going to address next, and the answer might surprise you. Here's the good news that the pharmaceutical industry doesn't want you to hear. You don't need to destroy your kidneys to manage pain effectively. There are safer alternatives that can provide relief without the devastating side effects of NSAIDs. But before I reveal these alternatives, let me address the elephant in the room. Your doctor might have told you that low-dose aspirin is different, that it's necessary for heart protection. This is partially true, but it's not the whole story. Even low-dose aspirin can cause kidney damage in seniors, especially when combined with blood pressure medications or taken for extended periods. A groundbreaking study from Australia followed 19,000 seniors for 7 years. Half took daily low-dose aspirin, half took a placebo. The results shocked the medical community. Those taking aspirin had a 21% higher risk of major bleeding events and showed measurably worse kidney function over time. The cardiovascular benefits were minimal, but the kidney damage was significant. Now, let's talk about what actually works without destroying your organs. Alternative number 1. Targeted physical therapy and movement. I know this sounds too simple, but research from Harvard Medical School shows that specific exercises can reduce chronic pain by up to 60% in seniors. The key is finding movements that strengthen the muscles around painful joints without causing additional stress. Alternative number 2. Topical pain relievers that don't enter your bloodstream. Creams and gels containing menthol, capsaicin, or topical NSAIDs provide localized relief without systemic absorption. Your kidneys can't be damaged by medications that never reach them. Alternative number 3. Heat and cold therapy used strategically. 20 minutes of heat followed by 10 minutes of cold can reduce inflammation and pain as effectively as oral NSAIDs, but without any side effects. This technique works by increasing blood flow and reducing nerve sensitivity. Alternative number 4. Turmeric and curcumin supplements with proper absorption enhancers. Clinical studies show that curcumin can reduce inflammation and pain as effectively as NSAIDs, but it actually protects kidney function rather than damaging it. The key is choosing supplements with piperine or phospholipids to enhance absorption. But here's what's even more important than alternatives: protecting the kidney function you still have. If you've been taking NSAIDs regularly, your kidneys need active protection and repair. The first step is immediate hydration. Your kidneys need adequate water to flush out accumulated toxins and begin healing. But not just any water will do. Dr. Amy Peterson, a nephrologist at Stanford Medical Center, recommends what she calls kidney healing hydration. This means drinking water consistently throughout the day, adding a pinch of high-quality sea salt to help with absorption, and avoiding beverages that stress the kidneys like alcohol, excessive caffeine, and sugary drinks. The second step is supporting kidney detoxification with specific nutrients. Cranberry extract, not cranberry juice, has been shown to help kidneys recover from NSAID damage. Alpha-lipoic acid protects kidney cells from further damage. N-acetylcysteine helps rebuild the kidney's natural antioxidant systems. The third step is managing the underlying conditions that make NSAID damage worse. High blood pressure, diabetes, and dehydration all accelerate kidney damage from NSAIDs. If you have any of these conditions, and you've been taking NSAIDs, you're at extremely high risk and need immediate medical attention. Here's a protocol that has helped thousands of seniors protect and even improve their kidney function. Stop all NSAIDs immediately unless prescribed by a doctor who knows your complete medical history. Replace them with the alternatives I mentioned. Drink at least 8 glasses of clean water daily. Take kidney-supporting supplements under medical supervision. Monitor your symptoms closely and get regular kidney function tests. But here's the most important part. This isn't just about stopping medication. It's about changing your entire approach to pain management and health. Robert Chen, a 72-year-old retired engineer from California, followed this exact protocol after discovering his kidney function had dropped to 45% from years of NSAID use. Within 6 months, his kidney function improved to 65%. His pain levels decreased. His energy returned. His doctor called it remarkable. Robert calls it getting his life back. The senior health medication alert I'm giving you today isn't just about avoiding harmful drugs. It's about embracing a completely different approach to aging and health management. Now I want you to imagine something. Imagine being 75, 80, even 85 years old, but still having the energy to play with your grandchildren. Imagine being pain-free without depending on medications that slowly kill you. Imagine having the peace of mind that comes from knowing you are protecting your most vital organs while still living fully. This isn't fantasy. This is what's possible when you make informed decisions about your health based on real science instead of pharmaceutical marketing. If this information is changing how you think about pain management and medication, I want you to let me know. Comment below and tell me where you're watching from. Are you in Florida, California, New York? Let me know your location and whether this information is new to you. Your engagement helps this crucial information reach more people who need it. Now I need to tell you something that might be hard to hear, but it's absolutely essential for your survival. The medical system is not designed to protect you from medication side effects. It's designed to treat symptoms quickly and move on to the next patient. Here's a statistic that will shock you. The average doctor spends less than 7 minutes with each patient. In those 7 minutes, they're supposed to diagnose your problem, review your medications, consider drug interactions, explain side effects, and provide treatment recommendations. It's impossible to do this thoroughly, and your kidneys pay the price. Most doctors receive less than 4 hours of nutrition and preventive medicine training in their entire medical education, but they receive extensive training from pharmaceutical representatives, who teach them which drugs to prescribe for which symptoms. This isn't a conspiracy. It's just how the system works. Dr. Marcus Thompson, a former pharmaceutical sales representative turned patient advocate, revealed something disturbing in his 2023 book, The Prescription Trap. He says, "We were specifically trained to downplay side effects and emphasize immediate benefits. Long-term complications like kidney damage were mentioned briefly, if at all. The goal was to get doctors comfortable prescribing our drugs quickly and frequently. This explains why your doctor might have never warned you about NSAIDs and kidney damage. They might not even know the full extent of the risk. The information exists in medical journals, but it's not actively taught or emphasized in practice. But here's what is even more troubling. The symptoms of kidney damage are so similar to normal aging that they are often dismissed or misdiagnosed. Fatigue gets blamed on getting older. Swelling gets attributed to standing too long. Changes in urination get explained away as prostate problems or bladder changes. I've seen case after case where patients complained of these symptoms for months or even years before anyone thought to check their kidney function. By then, the damage was irreversible, and dialysis was their only option. Eleanor Rodriguez, a 68-year-old grandmother from Arizona, told her doctor for 2 years that she was feeling more tired and her ankles were swelling. She'd been taking ibuprofen daily for arthritis pain. Her doctor ran tests for heart problems, thyroid issues, and depression. Nobody checked her kidneys until she collapsed at home and was rushed to the emergency room. She'd lost 80% of her kidney function. The system failed Eleanor, and it's failing millions of seniors every day. But you don't have to be one of them. Here's what you need to understand. You are your own best advocate. You know your body better than any doctor who sees you for 7 minutes every few months. You have access to the same medical research that doctors have, and you have something they don't: a vested interest in your long-term health. The information I'm sharing with you today isn't hidden in secret medical journals. It's published in respected medical publications like the New England Journal of Medicine, the American Journal of Nephrology, and the Journal of the American Geriatric Society. But it takes time to research, understand, and apply this information. Most doctors don't have that time. You do. This is why I'm so passionate about educating people about these issues. Knowledge is the only thing that can protect you from a system that's more focused on quick fixes than long-term health. If you're feeling overwhelmed by the responsibility of managing your own health, remember this: you're not doing this alone. There are resources, there are alternatives, and there are doctors who will work with you to find safer solutions. But it starts with you taking control, asking the right questions, and refusing to accept dangerous medications just because they're convenient or commonly prescribed. The last call to action I'm going to make is this. If this information has opened your eyes to the risks you're facing, hit that subscribe button now. Because the information I share on this channel could literally save your life or the life of someone you love. Let me leave you with the most important points from everything we've discussed today. First, NSAIDs like ibuprofen, naproxen, and even low-dose aspirin can cause irreversible kidney damage in people over 60. This isn't a rare side effect. It's a common, predictable consequence that happens to thousands of seniors every year. Second, the warning signs of kidney damage are subtle but recognizable. Changes in urination, unexplained fatigue, gradual swelling, shortness of breath, and loss of appetite with nausea. If you have any combination of these symptoms and you've been taking NSAIDs, see a doctor immediately and request specific kidney function tests. Third, there are safer alternatives for managing pain that don't destroy your organs. Physical therapy, topical treatments, strategic use of heat and cold, and natural anti-inflammatory compounds can provide effective relief without the devastating side effects. Fourth, your kidneys can heal and improve if you stop the damage and support them properly. Proper hydration, kidney-supporting nutrients, and eliminating the medications that cause the damage can restore function that you thought was permanently lost. And finally, you cannot depend on the medical system to protect you from medication side effects. You must become your own advocate, do your own research, and make informed decisions about your health. The choice you make today could determine whether you spend your golden years healthy and independent, or dependent on dialysis machines and facing constant health crises. I want you to take action right now. If you're currently taking NSAIDs regularly, talk to your doctor about safer alternatives. Don't stop medications abruptly without medical supervision, but don't continue taking them without addressing the risks. Get your kidney function tested with the more sensitive cystatin C test, not just standard blood work. Start implementing the safer pain management strategies I've outlined. Begin supporting your kidney health with proper hydration and nutrition. Most importantly, share this information with the people you care about. Your spouse, your friends, your family members who might be unknowingly damaging their kidneys with medications they trust. The pharmaceutical companies spend billions of dollars marketing these medications. They won't tell you about the risks. Your doctor might not have time to explain them. But you now have the knowledge to protect yourself and the people you love. This isn't just about avoiding medication side effects. This is about taking control of your health, your future, and your right to age with dignity and vitality. If this information has been valuable to you, show your support by hitting the like button, subscribing to the channel, and sharing this video with anyone who needs to hear this message. Your engagement helps this life-saving information reach more people who desperately need it. Remember, your kidneys are irreplaceable. Once they're damaged, that damage is often permanent. But the power to protect them is entirely in your hands. Take that power, use it wisely, and live the healthy, vibrant life you deserve.